Today, our guest is Dr. LUBNA KAMAL, MD Homeopathy, MBA, PhD, Associate Professor, Department of Materia Medica, State Jawaharlal Nehru Homeopathic Medical College, Lucknow, UP, India. The homeopathic nephrologist, treating renal failure and other patients suffering from chronic diseases since last 2 decades. The topic is case taking in a patient with renal failure. We know that the normal procedure, what they are doing or what happens to a patient when he is diagnosed as renal failure, very tragedy. A lot of problems are there, renal transplantation is there, there is no scope, no surety of life, but with single sweet pills, homeopathic medicines can give a rational cure to that patient. It's a wonderful thing, and on behalf of IFPH, I am welcoming Dr. LUBNA KAMAL. You can have the platform for next 45 minutes. It is followed by a discussion of 15 minutes. So over to you, Doctor.
Hello, everyone. I have been speaking on renal failure since a number of sessions on this platform. And I would like to thank everyone for having me here and to the audience as well. Today, the topic is case taking in chronic cases, or you can say specifically in renal failure cases, because that is where I feel that homeopaths fail. We have excellent medicines, but why is it that most of the homeopaths are not able to treat or give relief to such kind of patients? So the most important thing is, what is case taking? So case taking, it is a process or an art of collecting all possible information from a patient by means of either conversation, examination, and their observation as well, not just from patients, but sometimes from the attendants as well. And we all know that a case well taken is already half cured. Why is that so? Because when the patient is able to tell you about his complaints completely, they are sort of relieved. By the time the case taking ends, be it for 15 minutes, be it for 30 minutes, or be it for an hour, by the time it ends, patient gains some kind of confidence in you, and they start putting trust in you. So this is something very important. And Dr. Henneman, in aphorism 83 to 104 of Organon, he has explained everything possible about case taking, and I would request everyone to go through it from time to time, because what happens is, during our busy practice, we forget. There are a lot of things we forget. So it needs, brushing up from time to time. And one important thing that I have felt that the patients can do to ease our case taking is, you can, whenever the patient takes appointment, you can ask the patient to write their symptoms and come. If they are coming for the first time, if they cannot do that, then from the next time onwards, whenever they come for follow-up, why am I telling you this? Because there was a patient from Bihar, and he was like a simple, I think, auto rickshaw driver. His relatives were coming to take some medicine to Lucknow from here, and he had some troubles. So I said that he consulted first over the phone, and then he said that I have such and such problem. So I said, okay, fine. You send me your photograph, and he had some skin trouble, and we can talk on the phone later, and then I'll prescribe you medicines. So what he did, not only he wrote very neatly all his symptoms, he drew a diagram of himself. He drew a picture of himself and just an outline, and he marked everything. Headache, this part of head, and armpit, boil in armpit, and like stomach, this thing, and piles, and everything. He had put arrow around that. So I found that very useful. I mean, my case was half done. So that is a very good practice if the patients can bring beforehand. So now we'll start with the actual topic. And the most important thing before a doctor is confidentiality. While you're taking the case, or even before you start taking the case, you have to assure the patient that whatever information they are divulging, that will remain confidential with the doctor. So that is something which is very important, and it should be the first step, the building of trust. Then what we do next is we take the name of the patient. We usually write down the name of the patient, which is again very important. We should write down the complete name of the patient with the surname, with the prefix. Everything should be there, because a name actually reflects a lot of things. Then the whatever is reflected, I mean, the caste, the religion, the nationality, mixed caste and mixed religion also is reflected from the names, because there are a number of inter-religious and inter-caste marriages. So there was a patient of mine, he is still under the treatment and he's suffering from CRF, and the lady had two castes as her surname. So I asked, why is that so? So she told that we had a love marriage. And that is, from where the case started, because she told that that is where the trouble started, because the parents from both the sides did not accept the marriage. Then is how she developed hypertension. Her husband also was ill, and they were under a lot of stress. So that was the beginning point of my conversation with her, and the case taking became very easy. Another important thing is the date, not just for the case record, but for medical legal purposes also. And a case well taken is half told, that we have already discussed. The most important thing is the treatment, obviously, then the prognosis, the diagnosis, the investigations, what we are trying to tell the patient at the end of the case. That actually becomes very easy, because if you have thoroughly examined the patient, if you have thoroughly noted all the complaints of the patient, say if the patient is of CRF, but he is like showing a little bit of trouble in right hypochondrium. So if you skip it, then you'll skip the test as well. You'll skip, you might just advise them to go for a USG KUB, and you might just tell them to go for a KFT and leave the liver altogether. But there might be some trouble in the liver, there might be some other trouble in the thyroid, which we might miss. So a thorough case taking, it ensures that we will advise correct investigations as well, and medical legal cases and the medical certificate for that. Our case taking, our case record is very important, and the date is also very important. Then the next thing is the age. There are different diseases specific to different age groups, like the childhood, the teenagers, the adolescents, the geriatrics group. They all have different kind of diseases associated with those age groups. First, since we are specifically addressing renal failure, so above 65 years of age, 1 in 5 women and 1 in 4, 1 in 4 women and 1 in 5 men, they have some kind of some stage of renal failure. That is the proportion. And 38% of renal failure patients are 65 years or older. 12% are between the age of 45 to 64, and 6% are between the age of 18 to 44. This is how the age matters. The nephrotic syndrome is mostly, it affects the children, especially as people come to know of nephrotic syndrome usually at the 3rd year of life, or afterwards, after, I mean, 3rd year, 4th year, or 5th year. And usually it gets over. If it has to be cured, it is usually, it takes at the age of 12, it is resolved, or it progresses. So it is the nephrotic syndrome is restricted, most of the time it is restricted to the children. The next important thing is the gender. As we have already discussed, as I already said, that renal failure is more common amongst female, and there are other diseases which are specifically common to one gender or the other, or still the other. Then the address. Most of us do not know the address, and what we do at the most is we just note the name of the city or the area. But I'll tell you that there was an incident. I had gone to SGPGI Lucknow for a collaborative study, and they had asked me for the reports. So initially we gave 20 or 25 reports, the initial and the final reports, where the creatinine came to normal. So then they asked that we cannot believe that these are CKD patients or chronic renal failure patients, because they can be ARF also. So how can you prove that? So what we did, out of those 25, I had case record numbers of SGPGI itself, and I gave the list to them that these 12 cases are from SGPGI itself, and you only have diagnosed them as CRF. So they took all the details from us, and later we came to know that they had complete information about all the patients. We had the addresses and the PIN codes. So they wrote to each of the 12 patients, they called them. Then the patients came, they interviewed the patients, that what medicine did you take, what all happened, and how are you recovering. So the patients told that they were all, they were all right. So then obviously the matter was dismissed, but such is the importance, because you never know that the case, an impossible case might just get cured, and you might require to publish it somewhere, especially in peer-reviewed journals. You have to provide everything possible. So that is the importance of address. Then telephone numbers, we should at least know 2 telephone numbers, because in chronic cases and in these kind of life-threatening cases, I make it a point that my staff calls these kind of patients once in a while after 10 days or 15 days to ask about their whereabouts, how they are doing, if there is any trouble or not. So sometimes what happens, or even for reports actually, sometimes the patient tells on the phone that my creatinine has come down to 3.5, or maybe from a high level to a lower level. So they do not send the reports. So then we have to follow up, and we have to ask for the reports, and we have to get them. So at least you should have, when dealing with an important case, you should have at least 2 phone numbers of the patient, and essentially, if possible, the phone number of the patient. One can be of an attendant and one has to be of patient, so that you can directly communicate with the patient. Then another important thing is the religion, to which religion they belong, and this needs to be cross-checked because at times the names are confusing, so one has to be specific to which particular religion they belong. And apart from that, what are their moral and spiritual beliefs? Now, this is something which it can be discussed later, when we discuss the mentals, but this is something which is very important, because we have rubrics for fanaticism, we have rubrics for fundamentalism, then we have rubrics in our repertory for ritualistic behavior or extreme religious views. So that is very important. Then if a person is inclined spiritually, automatically it's easier to counsel them, because they are likely to be less depressed than the rest of the patients, and they have lesser suicidal thoughts. So sometimes they are associated with core religious beliefs as well. So when I was a child, like I was studying in 4th or 5th standard, I was very weak with mathematics. And before every mathematics examination, I felt like committing suicide. That I did not wanted to appear for exam, and it was easier for me to commit suicide. But because it was ingrained by people around me that it is a sin. Committing suicide is a sin. So that was probably the only thing that overruled the fear of mathematics, and I did not commit suicide. So the spiritual values, the spirituality of the patient, the moral values, and the religious beliefs, they are very important, and that should be asked in brief about in the beginning, and then later on when the patient is cozy and comfortable, then it can be discussed in length later. The education is very important, whether the patient is illiterate, semi-literate, or uh, absolutely literate, because at times you'll find it difficult to explain to illiterate patients. They take longer to understand. They are sometimes not able to read the instructions on the diet charts and on the medicines. A few years back I was giving a dropper, like whenever I used to dispense the medicines in 50 millismol, I used to give a white small dropper. So what happened? The patient came and they said that my eye is burning like anything, and it is in a very bad state. So I said, and it was the next day. So I said, what could have gone wrong possibly? There's no absolutely reason, no reason why you have a trouble in your eye like this. She said that I'm putting the medicine like 5 drops. You said morning and evening. Oh my God! I mean, the patient, instead of having that medicine with the SL, we put SL, a little bit of SL in the medicine, because it tastes like then it tastes like homeopathic medicine. So the patient was, instead of having it on the tongue, they were putting it in the eyes. So one has to be very, very careful with the instructions we give to the patient, especially with the semi-literate and illiterate ones. There is another problem with the literate patients. Now they do a lot of search on the Google, and it is so difficult to get symptoms for them. They only use the medical terms. I mean, in order to sound literate, they only use the medical terms. There's pain in my kidney. There is some trouble with the liver. I'm having GERD. Okay, so I asked, what is GERD? I always ask. So you have to be, you have to note it down. What kind of what is the educational status, and then only you'll be able to ask those kind of questions. So this was all about the beginning of the case. How do we begin, and how do by this time the patient is little cozy, and then we go on with the complaints. So initially it's the patient who narrates the complaints, and please allow them to completely narrate whatever.
The quantity of water, 5 liters of water is advised by allopathic doctors to take for a patient. Is it good, or what is your opinion on the homeopathy concept?
Actually, the fluid intake is directly dependent on the urinary output, and that is why I said that whenever you are taking a suspected case even of renal failure, you have to ask the patient to measure urinary output of 24 hours.
Good. Okay.
They can do it in a this very simple, this very 1 liter bottle. You just have to ask them to cut the top part, and so that it is widened from above, and then the urine can be collected there. Or if anyone has a measuring flask, then they can collect in that, because that is something very important.
No, it's regarding the quantity, 5 liters of water. What is the impact? Is it good or not?
If they are not able to pass urine, then they can be anything. They can have pleural effusion or pericardial effusion, maybe hepatitis.
Yes, hydronephrosis cases. Do you have any experience of cure cases?
Hydronephrosis, yes. I just posted a case just a few days back. There was a patient from Allahabad. He had a stone of 12 mm. It was stuck in the ureter, right ureter, and it was causing great distress to the patient, and the creatinine was also a little high because of that. So I just gave Calcarea salt was the constitutional medicine, and the symptoms, the way the symptoms changed, I gave I think vulgaris tincture and the Sasa Parilla tincture. And the stone came out, I think, in less than a month. It was just 20 days. And he passed the stone. And I even posted it on my Facebook wall. The patient had sent the video of the stone, and I have posted there. So excellent treatment is provided that the constitutional medicine should be correct. Because the other palliative medicines, the Berberis vulgaris or the Sasa Parida or the Magfos for pain, they will only help. But I doubt that only those medicines cannot make the stone come out unless and until you give the constitutional. Because
Okay.
actually the constitutional medicine actually changes the pH of the urine, and that is how the stone breaks, and then it comes out.
Okay, sir. Okay.
Okay. Next,
Yes.
next thing I like to add is
Yes.
see the women's purposely they are blocking their urination due to the non-availability of the urinals, and that is one of the main cause for the CKD for women's. I think it's so. Is it correct, madam?
Yes, actually, that is the leading cause of UTI in females. The females who are working outside, especially in malls and all, they either do not get time to go to the urinal, or the urinals are in a very bad state, especially the doctors, even the doctors and the teachers posted in rural areas. You know, they cannot go to the toilet. There are patients that there was a patient who was teaching in Amity University or some other university a long time back. She could not go to the urinal. She would not use. It was only when she came back to her house, then only she would use it, and she had persistent UTI.